Hi, I'm Dr. Dan Sindelar, and now we find that one of the biggest opportunities we have as dentists is coordinating referral systems between dentists and physicians in our area. One issue that might come up is you might not feel comfortable reading lab reports. And, oh, does that mean I have to go back to med school to understand all of this? It's really not that complicated. When you get to know those and know what the numbers are, it's simple. I even have a cheat sheet. I've got a sheet that I've put together that shows the parameters and where the patient should be, and also a little bit of a narrative on how important that is to what I do. That makes it easy for my team, it makes it easy for me, and I don't have to be going back to reference books trying to find out what the proper numbers are. The next problem is, when will I ever have time to communicate with the physicians? Well, there are numerous softwares you can utilize, and that makes it very easy. There's pre-made letters, there's form letters. You just communicate. I personally do sleep appliances and oral sleep appliances in my practice. Every time I do one, I make sure I send a letter to every one of that patient's physicians. I want them to know, all of them, that I am involved with that. One of the examples of a software is My Dental ETC. We use that in our screening process, and everything we need to communicate with the physicians is already in the software as we go through our screening. So when we need to generate a letter, it's real simple, and we just punch a button and out it goes. We document it, we know what we've sent them, and it just becomes like clockwork. Another obstacle is how much or how involved am I supposed to be with that particular physician. Every physician will be different. Some will want just a little bit of your help, some will want a lot of your help. Be willing to just accommodate what their needs are, and that will set you up for success in communicating with the physician. Another problem that I've found is sometimes the physician has no interest in partnering with you. And that's okay. Just to give you an idea, sometimes that'll be the one that ends up following you and you following them the best. I can think of a couple of instances in the past where I didn't get a whole lot of response, and then as time went on, those end up being the ones that really catch on and really want to connect with us the most. Don't not connect with a physician because you're afraid they're not going to connect back. Connect with them, let them understand what you're involved with, and then wait for them to respond back. Another concern is, how do we carry this out? Delegate this to a team member. We have a specific place in our office where everything's handled for this using the software. Doesn't take much, and they carry it all out. Another thing is, how do we approach patients with their problems, their medical problems? We have customized our care specific to where their risks are and also what's going on in their life. You'll find there's two distinct groups here. There are those that are at risk for certain health problems. We address them in a certain way. There are also those that have current problems going on. We address them to help reduce their complications. So there are bumps in the road that we can all anticipate connecting with physicians and coordinating that care. But there are simple steps you can follow that can really eliminate that and make it a real smooth transition, so you can go ahead and feel comfortable communicating with physicians, elevating your care, and really expanding your practice in a side that you never thought was possible. The benefits of improving your care, coordinating with physicians, and expanding your practice far outweigh the little bit of effort it takes to go ahead and incorporate these systems. So tell me what your concerns are in coordinating care with physicians. Please comment below.